Every year, there are 3.8 million sports-related concussions or mild traumatic brain injuries that are sustained by athletes. This number itself may be astonishing, but thousands, maybe even millions more, go undiagnosed every year, and even more are sustained by those who are not athletes. Individuals who suffer from a concussion experience symptoms that could last days, weeks, even up to months or years. The lasting effects of concussions are not greatly yet understood. Long-term effects can lead to prolonged experience of symptoms, cognitive deficiencies, and could eventually result in death. Chronic traumatic encephalopathy, or CTE, is a degenerative neuropathy that has been linked to the progressive deterioration of mental and physical health, especially in athletes that have suffered from recurring head trauma. Research shows that approximately 17% of athletes that have sustained mild traumatic brain injuries develop CTE, and this number is estimated to have a higher occurrence because it's so difficult to diagnose. A concussion is a form of a mild traumatic brain injury. Common symptoms include headache, dizziness, sensitivity to light and sound, memory impairment, and behavioral changes. Each concussion is different for each individual, so the subjective nature of concussions make it difficult to diagnose. Patient reporting of symptoms is the main diagnostic tool, as well as a SCAT test and a neurological assessment. Concussions are treated with rest, restriction of strenuous physical and mental activity. Athletes are allowed to return to play after they have completed a rigorous protocol that must be passed, with each phase resulting in symptom-free participation. This can usually take up to 1 to 2 weeks. If athletes return to play too early, they risk sustaining another brain injury. After an individual has sustained one concussion, the force needed to sustain another one dramatically decreases, and symptoms are usually more severe and prolonged. Research has begun to develop a blood test that analyzes specific biomarkers in order to determine the severity of the concussion and the ability of the athlete to return to play. One of the main biomarkers that is examined is the tau protein. Tau is a protein that is released from nerve cells and provides structural support to the axonal cytoskeleton. This is the framework that helps control the growth of the brain's neurons. Tau is by nature a relatively unfolded protein and is intrinsically disordered. This means that the polypeptide chain is highly flexible and mobile, and there's a low content of secondary structures. It specifically stabilizes and supports microtubules. Microtubules stabilize cell shape and act as tracks for the intercellular transportation. Tau's role is to stabilize the microtubules by binding to the microtubule surface. When brain injury occurs, there can be an associated change in the tau protein. After brain injury has occurred, the tau protein undergoes hyperphosphorylation, which decreases the affinity of tau to bind to the microtubules. Because tau is unable to bind to the microtubules, it aggregates in the cell and forms neurofibrillar tangles, which eventually causes cell death. Research has begun to test an immunoassay that detects tau as a biomarker in the blood after a concussion has been sustained. Studies have shown that higher levels of the tau protein can be detected in the blood at 6 hours after a mild traumatic brain injury has been sustained and is linked to a more severe concussion and a longer associated return to play for the athletes. This new test can give sports medicine professionals an extra edge when assessing concussions and determining if an athlete is ready to return to play.
Being a two-sport athlete in college, I was aware of head injuries, but little did I know how much they affected life. And during my 4-year career, I was disqualified by NCAA due to my 7 concussions. And to this day, I still feel symptoms of migraines, headaches, short-term memory loss, and I'm just overall fatigued all the time. And as I look to my future, I get scared of what's going to happen just because I know my symptoms will forever be there.
Mo, how do you think this test will impact you in your career in the future and how you approach concussions in your treatment of athletes? Do you think this would have made a difference in how your concussions were treated and how they affected your life today?
Well, as an athletic trainer, it's difficult to take each case. Every injury is individualized, and being able to realize the severity of each concussion or head trauma that a patient is experiencing will allow us to provide a rehabilitation plan that's more suited for them and the damage that has been done. As an athlete, it would have been nice to know the severity of each concussion that I had and to really, if I needed more time to rest in between going back to sport or if I should have stopped playing sooner instead of having long-term effects.